You're sitting at a kitchen table, the clock ticking in the quiet. Across from you, someone you care about is pretending not to see you. You ask a question. Nothing. You apologize for whatever you think you might have done. Their face is a wall. The silence starts as an awkward beat, then stretches into something colder. You begin to shrink inside, questioning yourself, replaying every word you said. You can't name what's happening, but it weighs on your chest. The air is heavy, the emptiness deafening. The more you try to bridge the gap, the wider it grows. This is called the silent treatment. In clinical psychology, it's not just someone needing space. It's a deliberate act, a tool used to punish, control, or destabilize. The term has been studied deeply by Dr. Kipling Williams at Purdue University, who spent decades researching the effects of ostracism, the experience of being ignored and excluded. When you're cut off from someone's words, you're not just being inconvenienced. You're being psychologically manipulated, whether the other person fully intends it or not. Most people don't even realize how calculated or damaging it can be. But you're about to get the language for it, the words that psychologists use behind closed doors. Clinically, the silent treatment is defined as a form of emotional withholding. It's a tactic where one person intentionally refuses to communicate, often to assert power or punish another for some perceived wrongdoing. In its mildest form, it's an icy pause in conversation. In its most weaponized version, it can last for days, weeks, even years. Dr. Williams's research on social exclusion found that ostracism, being ignored, activates the same areas of the brain as physical pain. This isn't a metaphor. In a 2003 study, Williams and colleagues used functional MRI scans to show that the anterior cingulate cortex lights up, just as if you stubbed your toe or broke your arm. In everyday language, your brain doesn't know the difference between rejection and real physical injury. You feel the ache in your body, not just your mind. The mechanism is primal. Humans are wired for connection. When you are excluded, even briefly, your nervous system goes on high alert. You become hypervigilant, scanning for clues, desperate to repair the bond. This is why the silent treatment works. The person on the receiving end often becomes anxious, apologetic, even desperate, while the person wielding silence feels a surge of control. The silence itself is the punishment. It removes the possibility of resolution, leaving you suspended in uncertainty. You're denied the basic human need for social belonging. That's why it feels like suffocating. And it works whether the silence is absolute or peppered with icy, monosyllabic replies. The weapon is the withdrawal, the chilling absence of response. Think about a romantic relationship. You have a disagreement, maybe something small, like forgetting to call or arriving late. Instead of talking it out, your partner shuts down. Minutes pass, then hours. You ask if they're okay, if you can talk, but nothing comes back. You start apologizing for things you didn't even do. You try harder and harder to get them to look at you, to say something, anything. You feel pathetic, but you can't stop. The power dynamic shifts. Suddenly, you're the one scrambling for scraps of attention, and they're the one controlling the flow of connection. This is not just emotional immaturity. It's a power play. Or imagine the workplace where your manager stops responding to your emails after a disagreement in a meeting. You're excluded from calls, left out of last-minute decisions. In the break room, they avert their eyes, making sure you feel invisible. You might start to wonder if you're overreacting, but the exclusion is intentional. It's designed to undermine you, to make you question your value or standing. Studies show that workplace ostracism leads to lower job satisfaction, higher turnover, and even physical health problems. You can feel it in your posture, your sleep, your sense of security. The silent treatment at work is a kind of professional ghosting, a calculated erasure that leaves you unsure whether to fight back or stay quiet. And then there's family. Maybe you grew up in a house where one parent would routinely go days without speaking to you after you made a mistake. The dinner table would go silent, your presence barely acknowledged. As a child, you learned quickly what topics or behaviors triggered this withdrawal. You adjusted everything about yourself to avoid it. Your tone, your actions, even your needs. The silent treatment becomes a kind of emotional training, teaching you to fear conflict and to equate love with anxiety. Decades later, you still feel a spike in your heart rate when someone goes quiet around you. You know the silence as a punishment, even when no one names it out loud. So how can you spot the silent treatment in real time? First, notice sudden, unexplained withdrawal. One moment, conversation is flowing. The next, you're met with a wall of indifference. There's no stated reason, no explanation. Second, watch for selective engagement. They speak to others in the room, but not to you, making you feel singled out. Third, the nonverbal coldness, averted eyes, stiff posture, deliberate avoidance of even basic courtesies. Fourth, it persists even after you've apologized or when you try to repair things. The goal isn't resolution, it's to make you squirm. If you catch yourself endlessly replaying recent events, feeling like you're walking on eggshells, chances are you're in the crosshairs of this tactic. How do you respond without making it worse? Start by naming the behavior calmly, without accusation. You can say, "I notice you're not responding right now. If you need space, just let me know, but silence feels uncomfortable for me." This puts the dynamic in the open, stripping it of its covert power. Resist the urge to beg, plead, or over-explain. That only feeds the dynamic, confirming for the other person that withholding works. If possible, disengage. Literally leave the room, or shift your attention elsewhere. Say, "I'm here to talk when you're ready," and then stop chasing. In the workplace, document the lack of communication and bring it up in writing to HR or a trusted supervisor. I've noticed ongoing gaps in communication that are impacting my work. Can we discuss expectations for response? Don't escalate with coldness in return. Two silences don't make a conversation. Avoid venting to mutual friends or triangulating, as this deepens the drama and makes resolution even harder. The hardest move is to tolerate the discomfort without collapsing into apology or retaliation. You're showing that your self-worth doesn't hinge on their approval. This is the ultimate antidote. Here's the hard truth. Even knowing all this, most people won't see the silent treatment coming until they're in the thick of it again. The tactic works because it's invisible. It's simply the absence of something you need. But having the word for it is your only real defense. Once you can name it, you reclaim the power to respond intentionally. If you want to understand the full weight of what this does to your mind and your relationships, read Dr. Kipling Williams's book, Ostracism: The Power of Silence. The science will change how you see every conversation and every silence for the rest of your life. If this helped you see your own life differently, share it with someone who needs the words.